rotate your phone.
Oh, you can't turn your phone on.
Oh, there we go. Is that recording? You guys, we just got an error message. We're like both staring at my phone right now thinking,
Trying to read it.
what? It says rotate your... Anyway, you guys don't
Here
care.
we are.
Hi, guys.
Technology's not our thing, if you haven't noticed. We're not that.
I mean, we
Not
like to
that good.
think we are.
We
but
fake
anyway.
it.
Totally. Guys, what's going on? Happy Thursday. We are excited to be here. We're excited. We're just we're rocking through this live video. I'm sorry, our week got crazy, you guys. We really had plans to do this a lot earlier in the week. But you know what? You play the cards you're dealt sometimes. So today we wanted to run you guys through the phase 1 workout.
Yep.
And so if you have, any questions with this, or, if you want to do it with us, we'd love to have you do it with us. And so, I don't know, is there anything else that you want to say? Let's
Jump
get to
right
it.
in.
I'm going to grab, we've got like the kids' balls laying around all over. I'm going to bring that closer. Okay, so the only thing that you need for this one is just the ball. Let's go ahead and we'll get started. So phase 1, lay down on your back, and we're going to get things started with those posterior pelvic tilts with the abdominal bracing, or with the TA activation. And so first step, flatten your back into the mat, and then suck that belly button all the way into your spine and hold 1, 2, 3, and then relax everything. That was 1, we're going to do 10. Flatten your back, suck in that stomach, hold 1, 2, 3, there's 2. Flat back, suck it in and hold 1, 2, 3, there's 3. Keep going, Camille. And so on this, you guys, the whole purpose of this phase 1 workout is to just get that TA activated. It's that transverse abdominis muscle. It's the muscle that goes from your back. It wraps around your sides and connects right under that connective tissue in the front. It's that linea alba that gets separated with the diastasis recti. And so that's what we're trying to bring back together. Now, a lot of times people with this, when I say, okay, let's suck in your stomach, they'll just take a deep breath in. Okay, keep going. You're doing great. They'll just take a deep breath in. They'll inhale into their lungs, and it creates this negative pressure in your abdomen. I don't want you to do that. I want you to actually engage that TA, that stomach muscle in there, to suck your spine into your stomach. Okay, taking things to the next step, the next exercise with this, we're going to hit that same thing, posterior pelvic tilt, TA activation. Now what I want you to do is hold that while we're going to march, and then relax. Flatten your back, suck in your stomach goes into your belly button, hold, march, there's 2. We're going to do 10 marches on each leg. Posterior pelvic tilt, suck in your belly, march, there's 3. Keep going. Posterior pelvic tilt, suck it in, march, and then relax. Now, keep going, Camille. And so, it doesn't feel like it's a whole lot, but the whole purpose on this, you guys, you're going to be able to march for days. That's super easy to do. But what I want you to do is, this is where your focus is right here on your stomach. You're going to flatten your back, you're going to suck in that stomach, you're going to hit that TA activation, and then you're going to add the marches. When you add the marches, sorry babe, when you add the marches, it's going to want to pull your hips into an anterior tilt, or it's going to want to raise your back up off of the mat. Your objective is to keep it down, keep it flat, keep the belly button sucked in while you do the march. So again, your focus isn't necessarily on marching, it's on keeping your stomach sucked into your belly button while you do it. Alright, grab your ball.
So you'll notice I put my hands on my stomach, right on my lower abs, just because to put my mind with the muscle, like that helps me to connect it. Because I've done these moves forever and have never really engaged that part of my ab.
Sure, absolutely.
And so it didn't work. Go figure.
Okay, number 3 is the posterior pelvic tilt with just a ton of squeezes. And so we're going to flatten the back, we're going to tighten the tummy, belly button goes into the spine, and then we're going to add the ball squeeze. We're going to hold 1, 2, 3, and then we're going to relax. Flat back, tight tummy. Again, that's your emphasis. Ball squeeze. 1, 2, 3, and then relax. Okay, bonus on this. You guys know what a Kegel is? Kegel, what do you call it? Potato, right? It's the same thing. Basically, I mean, if you've had a child, you probably know what a Kegel is. And so that's where we're going to just tighten up what we call the pelvic floor muscles. After pregnancy, you have that baby sitting on there for especially the last trimester as the baby's getting bigger. Basically it's a hammock in your pelvis that the baby sits on. And then, of course, to make matters worse, what we're going to do at the end of the pregnancy is squeeze that baby out through those pelvic floor muscles. Basically, they get wrecked. That's the reason why, you know, there's some leakage going on. That's the reason why if you have some incontinence going on, then that's the reason why. And so, God, my explanation took too long. What you want to do with this, flat back, tight tummy, squeeze the ball, but then you're going to hit a Kegel contraction too.
Keep going, Jared.
I'm going to keep going. You're going to hit that Kegel contraction. How you do that, pretend like you're cutting off the flow of urine, stop peeing, or like you're trying not to pass gas. So I tell people, you know, don't pee, don't fart. And that's how you know you're doing a Kegel contraction. Flatten the back, tighten the tummy, squeeze the ball, hit the Kegel, don't pee, don't fart, hold 1, 2, 3, and then relax. That's what your ball squeezes look like. Well, so you'll notice that Camille and I are doing these, I don't know, I kind of like to do them in a circuit, so kind of, you know, A, B, C, D, E, rather than A, B, 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 C, C, C. Not right, not wrong.
I mix it up sometimes.
Just like a little variation.
To do something different.
Okay, so sometimes you'll
like
do
too,
like 30 in a row.
Yeah, when you do 30 in a row, it exhausts that muscle.
Totally.
And then you move on to a different move
right.
and you can do it. So I mixed it up. I would kind of do every other day.
Good tip. One's not right, one's not wrong. Just kind of personal preference, whatever you like.
Yep.
Bridges. So now we're on our back. We're going to hit that. So posterior pelvic tilt, stomach goes in, squeeze the glutes, lift up, hold the stomach in, 1, 2, 3, and then come back down. Again, bridges are fairly simple, right? You guys, most of you anyway, could probably do these all day long and be like, okay, I barely even feel that. However, the contraction that we're after is that abdominal, it's that TA contraction. We are going to work that over with this phase 1 workout. We want, Camille mentioned it earlier, kind of that mind-muscle connection. If it helps, you can even put your hand right on it and feel that contraction. Keep your stomach sucked in while you're doing these bridges. It makes them a little more difficult. Hopefully you feel it in your abs. You're going to obviously use the glutes to be lifting your hips up towards the ceiling, but we want you to feel that in those abs. We want that stomach sucked all the way into the belly while you're doing this.
Okay,
we're going for 10 contractions there with a 3-second hold. Okay, side lying abduction. We're going to roll over onto our sides. So right now we're on our left sides. First step, TA contraction. Again, so the side lying abduction, we're going to raise that right hip up towards the ceiling and then slowly lower it back down. You guys can probably do that all day long. These hip abductors are the muscles that we're working on, but the one that we're really after is that TA activation. All of a sudden, we're not on our backs, and so gravity isn't helping to pull our belly button into our spine. It's not full anti-gravity, meaning we're not like, you know, down on all fours or in a plank, but in this position, that stomach muscle, that TA, is going to have to work a little harder to support your core, to support your guts, to pull your stomach into your middle. Holding that TA while we're doing this side-lying abduction, that's what we're after. 10 raises on the right.
10.
Nice. And so now we're going to flip over. We're going to do 10 on the left.
Side.
All right, so right side, left side. So suck in your stomach, tighten that tummy up, and then hold that while we go up and down. Looks just like that, you guys. Looking good, looking strong. Awesome. 4. Again, the emphasis is right here. If it helps you to put your stomach right there, right on your abs, right over your belly button, even right below your belly button, just to focus on keeping that navel sucked in. Keep it drawn in tight. The other mistake that I see a lot on this is people will roll their hips backwards like I'm doing right now. If you feel it in the front of your hip, that's your indication that you need to push that hip forward more. I want you to feel it back here in your butt while you're keeping that stomach contracted. Okay, next is going to be, so that was abduction, abduction. Now we're going to do some side-lying adduction. So we're going to stay on my right side, but now I'm working my right leg. Left leg's in front. I'm going to lift that right leg up towards the ceiling and then come back down. But guess what? I've got a surprise for you. That's not the contraction that we're worried about. It's this one right here. Hold that stomach in. Basically, by the end of this, it's basically 15 minutes of a solid TA contraction. We're going to activate that muscle. We're going to contract that transverse abdominis. But then what we're doing is just adding some different stresses in different planes of motion through the hips. So you'll see that we did the flexors with the march, the extensors with the bridges, we did the abduction, we're doing the adduction, we did some squeezes. We're just throwing all these different, let's see, we've got to go this way.
Yep, other side.
throwing all these different muscle contractions at it while we're holding that TA activation. So again, suck it in. I'm on my left side now. Right leg crosses in front. Left leg is the one that's lifting up and down towards the ceiling. 10 lifts on that. But again, right here, right in the stomach is where I want you to activate. That's the focus. That's the emphasis. So this is going to be a core workout unlike none you've ever done before. But that's the thing, you guys. We've got to mix up the process to get different results. If you've been doing the sit-ups and the planks and the crunches and you're like, oh, how come my core's not looking any stronger?
How come I don't have a six-pack?
You're not thinking deep enough. You've got to think into that deeper abdominal layer. Again, this muscle that we're after, this transverse abdominis, you guys, it gets hard to talk while you're doing these. So you got to hold that in. I feel like I'm winded. That transverse abdominis, that deepest abdominal layer, that's the corset muscle. That's the suck it in muscle. That's the muscle that's going to keep everything sucked in and tight and help you to lose inches around your waist and also heal up that separation. Yeah. We've done one round of each of these exercises. Let's jump into round 2. So we'll go posterior pelvic tilt with the abdominal brace. So flatten your back, suck in your stomach, and hold. 1, 2, 3, and then relax. Keep going, Camille.
Going.
Here's a good visual for you on this next one. So Camille's got a flat back. She's got a tight tummy. Camille, I'm going to punch you in the stomach. No, so that's the, so you saw, you kind of braced a little harder with that, right?
Yeah.
So there's your visual, you guys. If I'm standing over you, I should be able to punch you in the stomach. That should hurt my hand, not your tummy. Okay, I want it to be tight. Nice. I want it to be tight. That's the visual that I give people.
Didn't know I was going to be abused.
Flatten your back, tighten your tummy up, and then relax. Good. Flatten your back, tighten that tummy, suck in your belly button, hold, 2, 3, and then relax. So again, just a 3-second hold, tight contraction, looks just like that. Nice job, you guys, looking good.
We got 3 more.
Nice. I'm glad you're counting.
Kind of. I might be 1 or 2 off.
Cool.
Figure extras are good. Okay, there's 10.
Nice. Okay, next we're going to march. So stay right here. Flatten the back, tighten the tummy up, suck in the spine, contract the glutes, up towards the ceiling, hold, 2, 3.
Wait, we're marching.
Oh, we're marching. Guys, what the heck? Okay, flatten the back, tighten the tummy, march right, march left, and then relax.
I can tell we're professionals.
Flat back, tight tummy, march, and march. And again, with this march, it's going to want to rock your pelvis forward. Your objective is to keep your back flat and keep your stomach sucked in. That belly button should be in your lower back while you're doing this. Flatten the back, tighten the tummy up, march, march, and then relax. We're going to hit 10 of them. Flat, tight. Nice, good. Looks just like that. Try not to hold your breath. Sometimes I need to take a breath. I can't just talk to you guys the whole time. There we go. Flat, tight. Looks good, you guys, just like that. Flat,
so I know
tight.
that these exercises seem so simple and they almost seem silly. Like after doing planks and crunches and sit-ups, I thought these are way too easy. But the thing is, like, I was doing it all wrong. I just was activating the wrong muscles. I wasn't using my lower abs at all. And we've gotten how many messages? We're done.
Okay, nice.
But we've probably, I don't know, about 5 different people who've done it this week who've just started that have said, oh my gosh, my abs are so sore. And
so,
from doing these simple things.
It's a whole new muscle, you guys. It's a whole different contraction that we're after in there.
Yep.
Okay, good point. Okay, ball squeezes. Flat back, tight tummy, squeeze the ball, squeeze the Kegel, 2, 3, and then relax. Flat back, tight tummy, squeeze the ball, squeeze the Kegel, 1, 2, 3, and relax. Okay, so lots of squeezes on this. Tight tummy, squeeze the ball, don't pee, don't fart, and then relax. Okay, that's the Kegel contraction. We're after that abdominal, or excuse me, that pelvic floor. We've got the TA abdominal contraction. We've got the ball squeezes. We're working on the inner thigh as well. But then we're also hitting that pelvic floor contraction with that Kegel. Squeeze, 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 and relax. Good, you guys. The stronger you make those 3 muscles, the happier you're going to be. Trust me on that one.
Yes. 2 more.
Nice job. 2 more. Squeeze. Good.
Last one.
Flat back, suck in the stomach, squeeze the ball, squeeze the Kegel, and then relax. Nice job. Okay, staying right here for some bridges.
This time bridges.
I know, I love bridges. That's what I wanted to do. Flatten the tummy, squeeze the belly button in, up, squeeze the glutes, hold 1, 2, 3, and then come back down. And again, I've got my hand right there. You can kind of feel that contraction as you come up, come down. That's my emphasis, is right on that transverse abdominis muscle. It's not on the glutes. I mean, bonus, we're going to get a butt lift with this as well. But the contraction that I'm after, the one that you guys want, is that transverse abdominis. That's the one that's going to help to strengthen that core up. That's going to shrink that midline, that waistline down. That's the one, you guys, right there. Mommy tummy be gone. Nice, looks good. Good, about a 3-second hold up in the bridge, 2, 3. And then right back down, keeping that stomach sucked in. Looks good, looks good.
2 more.
Nice.
Last one.
That's one. Nice. Okay, over onto our side. Again, this is our second set. And so on our side, I'm on my left side. Left leg's bent, right leg straight on top. Suck in the stomach. That's the contraction we're after. Up nice and slow, down nice and slow. That's one. We're going to do 10 on each side. There's 2. Again, holding in right here. This is your emphasis. You guys are going to get so sick of me saying that. But that's what we got to do. Suck in your stomach, hold it in as we lift those legs up and down, up and down. Good.
If you're doing this with kids, or even your spouse or boyfriend, partner, whatever, if they're around you, have them hold a hand right over your lower abs. Jared would do that sometimes when he was working with me. And it just reminded me, like, oh yeah.
Like, oh man.
It's different when somebody else is like, squeeze it! Oh my gosh, okay.
Big time.
So.
Nice, really good, you guys. That was it? There's 10?
Yes.
Nice. Okay. And so the goal here, how long would you say each phase took you to run through?
So the first, I would say 3.
So, suck it in. I'm on my right side, left leg's out straight, up and down. This is the contraction right here. You would say what?
I felt like the first 3 phases, each one took me about a week.
Okay.
The 4th one, and I did them every day.
Nice. So you did 6 days a week?
6 days a week. Yeah, I usually took Sundays off.
Take Sunday off, you guys. It's a day of rest.
Day of rest. But, yeah, and then by the next week I was ready to do the next phase. But by the 4th, the 5th, and the 6th, each probably took me 2. The 6th one I'm still doing.
6th one's awesome, you guys. Can't wait to get there.
It's intense. So,
nice.
That's probably 10.
Okay, looks good. Stay right here on your right side. Left leg crosses in front. Same contraction on the TA. Now we're going to adduct that right leg up towards the sky. There you go. Cool. Okay.
So with me, I felt like Jared recommended that I do them every day. Unless I was so sore, I would take a day of rest.
Listen to your body, you guys.
Yeah.
I think that I put that, I'm pretty sure I put that in your guide, in your Mommy Tummy Fix program. Ideally, we're going to shoot for, 5 or 6 times a week on this. I mean, 6 or 7 if you can make it. But listen to your body, be smart about it. If you go even like 2 days on, 1 day off, maybe for week 1, you kind of do like an every other day thing if your abs are super sore.
Yeah.
Try to push yourself, try to get it done, but try to be smart about it.
So,
nice.
How do you know when you're ready to move on to the next phase?
Okay, that's a great question. And so what I tell people is, as soon as you feel like you can get through all the recommended sets and reps of each workout, of each exercise in each workout, then that's when you know you're ready to move on. And so if, you can get through phase 1, if you can run through all these exercises, you're doing them pretty good, you feel like, okay, hey, I feel like it's not as difficult as it was when I started it out, let's jump into phase 2. Phase 2 is very similar to phase 1. We're going to hold contractions a little bit longer, and we've got a couple of different exercises that we're going to mix up into it. But basically the idea is that this is a progression. Yep. That, you're going to get a lot stronger in 1 and 2 weeks than you are right now. And so when that happens, you want to keep progressing. You want to keep throwing different things at it so that you continue to get better and better and better.
And stronger and stronger.
And so that's why we wanted to do the whole 6 phases of rehab on this. All right, last set. Posterior pelvic tilt. Suck it in and hold. 1, 2, 3. Good. So the posterior pelvic tilt with the TA contraction with that abdominal brace. 2, 3, and relax. So in my PT clinic, when I get referrals for any postpartum issues, diastasis recti, SI joint, low back pain, the stuff that's common, post-pregnancy, I typically tell people I want to see you for 6 weeks. And then this is a very similar progression that I run people through. And again, the goal is to make that TA and basically, you know, the pelvic floor, the lower back, the spinal stabilizers, we want to make those all just as strong as we possibly can. And so it takes, you know, 4 to 6 weeks to make those gains in strength. In order for those muscles to strengthen, you've got to be consistent with it, and you've got to run through it for about 4 to 6 weeks to start to really see the changes in the muscle. And so that's why with this program, I wanted to take you through the entire, all the phases that I would run you through if you came into my physical therapy clinic and looking for some advice with it. But then, again, not everyone progresses at the same rate. So let's see, we got to march. Posterior pelvic tilt, suck in the stomach, and march, and relax. That's 1, we're going to do 10. Suck it in, march, and relax. There's 2. And so this is, I wanted to basically offer you the same program, the same progression that has been super effective for the patients that I've seen with these post-pregnancy issues. It's going to work, you guys. Trust the process. Put in the work. It's tough. It's tough. There's a lot to it, and sometimes, you know, you're going to feel like, oh, I just don't feel like I'm really seeing any progress. It's consistency, you guys. These changes don't happen overnight. You're not going to see them overnight. It's going to take consistency, and it's going to just, you know, taking your trust with what we're doing here.
I think our world is so used to getting results
immediately,
instantly, which is
Isn't
why,
there
like,
just a pill I can take?
Yeah.
Isn't there
tummy tucks,
just
like,
a surgery I can
surgery.
have? It's the easy way, you guys. The thing is, it's not as effective either.
You can't. You have to change everything that you're doing to make it last.
10 marches. We got one more.
One more.
Nice. Good. Flatten the back. Tighten the tummy. 10 marches. Okay. Grab your ball. Ball squeeze time. Okay. Flat back. Suck in the stomach. Hold that contraction. Squeeze the ball. Squeeze the Kegel. Hold 1, 2, 3, and then relax. Flat back, tight tummy, squeeze, 1, 2, 3, holding everything nice and tight, and relax. Flat back, tight tummy, squeeze, 1, 2, 3, and relax. We're going to do 10 of them. Flatten the back, tighten the tummy. Good. 1, 2, 3, and relax. So, we mentioned a little bit about pelvic floor postpartum, post-pregnancy. Obviously, you know, it goes through war, but there's a lot that you guys can do to rehab that. And so these Kegels, this is an important thing. Make sure you add that contraction to this exercise. If you feel like you can add it to even more of the exercises, have at it. This one's a little easier, especially as we're first starting out on this, to activate those pelvic floor muscles, just because they're closely related to the adductors. When I squeeze that ball and then try to squeeze those Kegel muscles, it makes that contraction even much more effective to do that. So remember to do that. But you know, if you can hit that Kegel while you're marching or even while you're kind of doing the side leg lifts, it's going to be even better for it. Okay, bridges. So flatten the back, tighten the tummy, squeeze the glutes, 1, 2, 3, and then come down. Again, the TA is active. My stomach is sucked into my spine. Up, hold, 1, 2, 3, and then come back down. Good, just like that. Up and hold, 1, 2, 3, and then come back down. Good, squeezing the glutes, so keeping that nice glute contraction, get that nice ab contraction, 3-second hold, back down we go. Looks just like that, you guys, looking great. We've just got a couple more exercises to go, and then we've nailed it.
2 more.
Nice. Squeeze the glutes, keep the stomach sucked in, that stomach, I want that stomach in your lower back, you guys, all the way in, and then back down. Okay, nice. So side lying abduction. So again, I mentioned this earlier, but what you'll notice, go ahead Camille, you're doing great.
Thanks.
But what you'll notice, we want that TA to be active. So again, that suck it in, that corset muscle. Camille's got her hand on it right now. That's a great cue to keep it sucked in. But we're holding that contraction while we're progressing these different core muscle and hip muscle activations. We've done front of the hip, we've done back of the hip, we've done outside of the hip, we've done inside of the hip. But again, the most important part is that abdominal bracing, that abdominal stabilization. I gotta catch you. Hold it in, up and down. Good, just like that. 10 contractions, 10 leg lifts.
Here's
again,
10.
Here's the most important part right here. Okay, I'll do 5.
Glad you could join me for 2.
Nice.
It's okay. had a lot more kids than you. Need it a little more.
Oh wait, what are we doing? So this one
Other
right
side.
here. Sorry.
Yep.
Okay, so keeping that TA nice and tight, everything's sucked in. We're going up and down for 10.
Okay, so when I first started doing these, I thought this is dumb. This
Well,
is Jane Fonda,
That's.
right?
I'm sorry that I let you down.
Here's the thing: you're like building a foundation because as it progresses, you're going to start doing side planks. And had I not done these first, I don't know if I would have been able to hold my TA while doing
Absolutely.
side planks. So
Absolutely.
know that you're gearing up for harder to come.
I tell people you've got to crawl before you can walk,
Yeah.
before you can run, before you can sprint. By the end of this, hopefully we're getting to a sprint, but right now we're learning how to crawl. We're activating that muscle. We're keeping it sucked in while we're activating some of these other leg muscles. Okay, adductors.
Last thing.
Laying on my left side, right leg crosses over, TA is active, suck that belly button into your back, and then you're going to squeeze that left leg up towards the ceiling.
This is a good one to do Kegels on too.
Nice, good tip. So those inner thighs, you guys, that's what we're all about. Suck it in, keep it tight, everything's sucked in, and then we're activating that bottom leg up and down, up and down. Looks just like that. Nice job, you guys. Try not to hold your breath. Your breathing should be consistent. You should be able to take breaths while activating, while holding in that TA muscle. Those should be independent of each other, meaning my lung function shouldn't be affected by holding in that TA. That's the hard part, is to separate those two.
Okay, switch to the other.
We want you to activate that abdominal brace, not just hold your breath. That's the easy thing to do. All right, last set. Here we go. Let's see. I'm on my right side. Left leg crosses over the front. Activate the TA. Right leg lifts up towards the ceiling. Last set of 10, you guys. Here we go. We got it. Keeping that stomach sucked in. Keeping that Kegel nice and strong. If you want to hit that, it's going to be a good contraction to add. We're halfway there. Last set. Finish strong. Nice job, you guys. Again, this is your emphasis right here. I like what's going on down there, but this is the one that I want to be active right up here. Keep that stomach nice and sucked in. We're going to hit it 10 times. Nice. Are you counting?
I think we're about there.
Do one more. Nice, you guys. There's your sets, just like that.
It is. So I would usually do these. So I do like some type of cardio or list. I almost did cardio or list every day. Like at least 30 minutes a day, sometimes 45, sometimes 20. It just depends.
Well, and it's one of those things. Don't overthink it. I mean,
Yeah,
you would take
go
the
for a
baby
walk
for a walk,
after
throw the
dinner.
baby in a
Yeah.
stroller, or like
Yeah.
go outside and walk around,
Yep.
or
So I did my list on Saturday was mowing the lawn. And it kept me at a
There you
perfect steady state
Love
the whole
that.
time for like an hour and a half.
Yep, you bet.
So I mean, just like don't overthink it, but do something to move.
Clean up after your kids. Like if you
Oh
have
my gosh.
stairs in your house, like
Yes.
take their toys upstairs one at a time, and do
Walk
that
up
for
and
a half
downstairs.
hour. I mean,
I've
like,
even done that with laundry. As I put laundry away, I'll do one piece
One-
of laundry at a time.
That's horrible.
So I got my workout and laundry got put away. So,
Yeah,
I
and
mean,
so there's ways
things
to
you
make it
can
work.
do.
We know you guys are busy.
Yep.
Camille's busy. Like there's
everyone,
ways.
every mom is. Every person is.
There's ways that you can look for to
Yep,
make that
and
happen.
can squeeze it in. And then I would do these just on the floor of my bedroom for like 10-15 minutes before I jumped in the shower, and it just became part of my routine that I just would fit it in. And
Right.
I mean, what you make a priority, if you make it a priority, you make it happen. And this was important to me.
Fantastic.
Yeah.
And so so you should be able to get through this. I mean, obviously there's a lot of dialogue with us. There's a lot of descriptions. There's me yapping at you the entire time. It's going to take a little longer when you do these workouts with us. You should be able to get through these in, you said about 15 minutes?
Yeah,
about
15 minutes max.
20,
Yep.
okay, 10 to 15 minutes.
Mhm.
Okay, you guys, that's it. Workout
That's it.
1, phase 1,
If-
complete.
Yep, and if you're feeling good, then you're ready to progress. Try phase 2.
Try that phase 2 out. If not, you might stay here. You might
Yeah,
do this
stay
a couple
here
more
as long
times.
as
You
you
might
need
do this
to.
for a week. This is your jam, you guys. This
Yep.
is your
And
progression.
you can always come back too and
Yep.
do these ones.
Absolutely.
And hold them for longer. Like just I would sometimes mix it
Yep.
up. So.
Absolutely.
Cool.
Okay, you guys, if there's any questions, comments, concerns, anything like that we can help you out with, please let us know.
Yep.
Let us know in comments to this video. Let us know in comments on the group. We're in there every day. We try to stay on top of those as much as we can. Thank you so much for your participation already. It's been really cool.
Yeah. Lots of cool stories.
Yeah, cool stories. Cool to get to know you guys. We're excited to
And lots
work
of
with
sore
you
abs.
on this. Cool stories, sore abs, and people who hate us for eliminating your soda. Yeah. Sorry, everybody.
You're going to be stronger
not really
of it.
sorry. Okay, you guys, have a fantastic day. We'll check in again soon.
See ya.